Hi everybody, Big Papa Scott here again. We're going to do a little lesson on the heart valves. If you remember, there are 4 chambers in the heart, and with those 4 chambers go 4 valves. The 4 valves are the mitral valve, the tricuspid valve, the pulmonic valve, and the aortic valve. Now these 4 valves all work in tandem to help the heart with the flow of blood through it and out of it. They are essential, and if they work properly, you can live a long and happy life. If they don't work properly, then you're in for some surgery, most likely. So I'm going to go over each valve and tell you what it does and explain some of the things that happen to them that cause us to have concern and actually the need to have them sometimes replaced or repaired. So we'll go into that right now. Let me get rid of some of this. No, just this. And what I want you to see is some of the valves. And we're going to start with the mitral valve, which is right here. The mitral valve itself lets blood flow from the lungs into the left atrium, and it lets blood from the atrium into the ventricle, so from here to here. And as the blood flows into the ventricle, then the ventricle pumps, squeezes, and pushes it out here, which is so this is the mitral valve. This right here is the aortic valve. And the blood goes out, and you can see the arrows all the way through the body up to the head. You can see these arrows here. And if you were able to visualize this, there's what's called the vena cava, inferior vena cava. I'm sorry, I'm wrong. The descending aorta, which is this right here, aorta. That will take blood to the lower part of the body, and it's all good oxygenated blood, which helps the body with its daily chores, running, walking, playing, whatever. It doesn't matter. It's oxygenated blood, and it provides the lifeline to us for a good, healthy life. So we'll go into some of the problems that the heart can have with these valves, and I think it's important for all of us to kind of know that these valves themselves all have important things that they do. I'll start with the mitral valve, which is again here. And the mitral valve, like I said, lets blood into the ventricle and out through the aortic valve. Now, in some cases, the mitral valve, which looks like this, and this is the atrium and this is the ventricle. In some cases, when the valve itself is closed, which would be something like this, there can be a leakage of blood that will go back from the closure of that particular valve, the mitral valve itself, and cause a leak that goes back into the left atrium. Now these leaks, which are usually right at the area where the valve closes, the two leaflets close together and they produce a leak. Can cause significant issues. The first thing they start to do is enlarge the left atrium, and it gets bigger and bigger, and the bigger it gets, the worse it is. So we want to make sure that, with time, we don't end up with a big left atrium that causes significant problems. And unfortunately, some people end up with those problems because there's really, it's an issue that happens to a lot of people. So as this gets bigger and wider, the severity of the valve leakage increases. The patient can start feeling short of breath and maybe has limited exercise ability, not able to walk very far or do anything that's physically taxing on the heart. So they end up having the valve replaced. So what I'll do is kind of give you an idea of how that is done. And what we see, the valve replacement, is they put in what's called a tilting disc valve, which has some components to it that allow it, I'm sorry, I drew that wrong, that allow it to open and close. So let's do that right. So what ends up happening is it tilts open into the ventricle, and there's what they call a sewing ring that if this was a three-dimensional model, you would see it all the way around the heart, and it basically tilts open to let blood into the ventricle, and then when it closes, there's no more insufficiency or leakage of blood going back to the atrium. So it solves the problem of a big leak, which is important. The valve replacement is open heart surgery, so it's not something very easy, to go through. It's a big surgery. There are some new techniques coming up that they are experimenting with and actually doing in some of the elderly patients that can't go through a full open heart surgery without passing away, unfortunately. And that involves a catheter and deployment of a valve. So we'll talk about that later, but this is the standard prosthetic valve that they put in. They also do this for what's called a mitral stenosis, which, if I were to draw that again, in mitral stenosis, so here you have the left atrium, and the valve itself, here's the ventricle, the valve itself gets very thickened and it will not open very well. So sometimes it gets so stiff that there's only a tiny little hole where the blood can get through, let's say right there to the ventricle. And that blood comes through at a very high velocity, and that's how you can tell how what we call stenotic or narrowed that valve is. The more narrowed it is, the bigger of a problem it is. Well, that didn't sound really well, but it's just like a valve that leaks a lot. It's just as significant. You get short of breath and you have problems doing things because you can't supply the rest of the body with enough blood because of this narrowing. Remember, they call it circulation for a reason. It's a big circle. There's a block somewhere in a circle of fluid, which, let's say a hose, if you were looking at a garden hose. If you block the flow, there's only going to be a trickle of flow coming out, like if you bend the hose. At the other end, there may be a trickle of blood flowing out where the blood can get through, but it's not enough water to actually water your garden, just like it would not be enough blood to actually help the body do its normal things. So what they do in this case is the same thing. They go ahead and replace the valve. And by doing that, they also will put in, I'm sorry, wrong thing. They put in a tilting disc valve, same as what I was talking about before. So it kind of goes like this, and this leaflet here will move back and forth and open to let blood flow into the ventricle. Those tilting disc valves are sewn in, so they remove the old valve completely. They sew in this new valve, which is, it used to have metal components, but now they're not always metal. There are some heavy-duty plastics that they use and things like that, because patients sometimes still need MRIs, and you can't have any metal in your body and have an MRI. So they're always working on new ways of making, parts non-metal if they can, so you can still have an MRI. So anyhow, the tilting disc valve works very well. It's been used for a very long time. Years ago, we were constantly using what was called a, it's just very interesting, so I'm going to draw it out for you here, was a, if you're looking at the mitral valve normally being in the middle here, right here, there was a cage that was like this, and it had a ball in it. And that ball was wide enough to stop right at where the valve closed, and then when the atrium contracted and the blood was needed in the ventricle, the ball would actually come down into this cage and let blood flow from the sides into the ventricle, and then the blood would go out the aorta and to the rest of the body. It was actually a pretty decent design, and it did very well for a number of years. You needed to be on blood thinners, and they did fail eventually, but the longevity of these valves was incredible. I saw patients who had them for over 20 years, and they were still working really well. So sometimes they change things because of side effects, so I'm sure that they changed to the tilting disc valve to help with problems with blood clotting. So anyhow, I thought I'd show you that because it is a very neat design, even though they don't really use it that much anymore, if at all. But history is important too, at least in my book. So now that explains basically how a valve is replaced and why it's replaced. Remember, for a narrowing or a stenosis, or stenosis is the same kind of thing as a narrowing, stenosis, or leakage. So if you have a very big leak in the valve, they will replace it for those reasons. Now, the interesting thing, in my opinion, is that these things all go hand in hand with the other valves. So let's say you're looking at I did it again. Let's say you're looking at the aortic valve, which is here again. The aortic valve, comes up like this and goes down to the rest of the body. That's the aorta. The aortic valve here can get thickened and not let enough blood through to the rest of the body. And then the aortic valve has to be replaced. And that can be replaced with several options. The aortic valve, if it's an older patient who's in their, let's say, 70s or 80s, they will replace it with a tissue valve, which is usually a cow valve. I think they still occasionally use pig valves, but I'm not sure. When I left, when I retired, we were mainly using cow valves, and they would put them in there. They would put them in, and then there's like almost like a bracketing or a circle that they sew them into, and then the valve would open and close like a normal valve, and it was made of tissue, so you still were on blood thinners, but you didn't have to be on the really heavy blood thinners. If it's a young person, they will replace it with a metal valve, like a tilting disc valve, like I showed you before. That's because it needs to last longer for those patients. You don't want to have to replace the valve, every 10 years. You want to have it go further than that, maybe 15 or 20 years if possible, before you have to replace it again, because no one wants to go through open heart surgeries multiple times. So, but the aortic valve can also leak, just like we were talking about before. So if you were to take a valve that actually leaked, whoops, I lost the caption on the top, sorry about that. If the valve leaked, it would leak directly into the ventricle. So let's say this is a leak here, and it's filled with blood, and it's leaking into the ventricle, which is here. Now, as time goes on, what happens is, with that leakage, the ventricle can get bigger, and eventually bigger. The bigger it gets, the less the less function you have of the ventricle. The ventricle will start to dilate and then not function well. If it gets to that point, you've almost waited too long to replace the valve. So what they try to do is, when they start to see these jets of insufficiency in like echo or in whatever else, then they start to, like let's say the jet looks like this. Well, then they try to replace the valve before the ventricle starts to dilate. So by doing that, once they replace the valve, that takes care of the problem. A lot of times the ventricle will come back down to size, to a normal size or close to a normal size. It's not always perfect. Now, if the aortic valve gets stenotic or narrowed, like I was explaining before, what happens to the ventricle is a little bit different. It gets thickened. So you can see this is what we call myocardium. Oh, can't get this right. And the myocardium itself, why is this not working again? The myocardium is a thickened, can be thickened, I'm sorry I repeated that so many times, by an increased pressure inside and an increased need to pump blood through that valve that's narrowed. So what ends up happening is this muscle, that's the main pumping muscle for the whole body, can get very thick. And the thicker it gets, the less blood that can be pumped out of it, because the chamber size is smaller. And if it gets too thick, it starts to block off this aortic valve up here. And when it blocks it off, then you can have a lot of fainting spells and other issues that can go along with it. So it's obvious you don't want to wait to that point to replace the valve. And that's, like I said, that's for a stenotic valve, or a valve that's, very narrowed and not opening very well. So that's called hypertrophy, or a thickening of the heart. So anyhow, that can be because of the aortic valve. Now these problems that we're talking about can also be associated with any other valve in the heart. So here we have the pulmonic valve, which is right here, and next to the pulmonic valve we have the tricuspid valve, which is right here. Now these are the right-sided valves, and it's a good thing they don't have to do a lot of work because they're only pumping blood to the lungs. So what ends up happening is, because they're only pumping blood to the lungs, not a lot can go wrong with them. Now, some children are born with a narrowing of the pulmonic valve, and the narrowing itself is a congenital defect. So what they end up having is, in this pulmonic valve area, there's a narrowing of the leaflets. It gets really thickened sometimes, and there will only be a little tiny hole going through the middle of it that allows blood to flow through to the pulmonary artery and then to the lungs. So this one goes to the left lung, this one goes to the right lung. So when that happens, the right ventricle can get very thick, just like the left ventricle does when it's stenosed. It can also start to dilate if it gets bad. So those two problems are big problems, especially for a child. And what they notice in most children or babies, in most of them, they have problems feeding. So they'll suck on the nipple of the mom or the bottle, and they can suck for, like, let's say 30 seconds, and then they have to stop, and they're breathing really heavy, and they can have some blueness in their lips, and that's a sign that there's pulmonary stenosis or some other congenital heart defect. So anyways, I wanted to explain that one to you. Now, the last one is the tricuspid valve. And if all the other valves were as reliable as the tricuspid valve in the sense of stenosis or narrowing, there'd probably be a lot of cardiac surgeons out of work. I have seen in 35 years 3 cases of adult tricuspid stenosis, or narrowing. That's how rare it is. So it's rare that it narrows, but one of the things that it does do a lot and can cause a problem is to leak. And when it leaks, it will leak back into the atrium, the right atrium, cause a big leak here. And if that leak increases to a significant amount, the pressures in the right atrium and then into the pulmonary system can increase greatly and cause what they refer to as pulmonary hypertension. Now, hypertension is high blood pressure. This would be high blood pressure in the lungs, in a basic sort of way. And that can be very dangerous. You can have shortness of breath, and that shortness of breath can last until you die or get worse until you die. So if there is a real problem with this tricuspid regurg, if it's so bad that it's causing severe pulmonary hypertension or it's an issue with it, they might go in and replace the tricuspid valve. So it does happen, but it is kind of rare to see them replace a tricuspid valve. So anyways, that's the story on the valves. I went too far on this one. This was a long explanation, but the valves are important for the heart itself, and it's a good basic explanation of them. And I know that there are things that the medical professionals will say that I missed, but this is not for medical professionals mainly. This is for the regular population to look at. So I hope I explained things well, and if you have any comments, just leave them in the comments section, and I want you to have a great day. Bye.